With hundreds of millions of people affected by diabetes across the world, it really is an international crisis, especially for low and middle income countries where cases are rising fastest. Joining me now is the International Diabetes Federation's president, Professor Andrew Boulton. Professor Boulton, COVID-19 is a global pandemic. How has this impacted those who are living with diabetes across the world?
Wherever you are in the world, COVID-19 and diabetes do not go well together. We try to shield them from risk and also to get the best diabetes control and to maintain some program of exercise, because again, people who do badly are those with poorer diabetes control and who are overweight. These are two other risks. So we need to care for people with diabetes, and people with diabetes need to understand the risk, but there doesn't seem to be any increased risk of those with diabetes actually getting the disease. It's if they get it, they don't do as well.
Why are we seeing exponential growth, especially of type 2 diabetes in low to middle income countries? Is it part of that shift towards a Western diet?
I think the answer to that is not simply a Western diet. There are many causes. It's genetic is one thing. Another thing is not just diet, it's change of lifestyle. When I first visited India 35 years ago, people were walking or cycling. I go frequently, and now people are on rickshaws or motorbikes. I drove last year, not myself, by the way, I was driven from Mumbai airport down to Pune, where I was giving a lecture. We stopped for a coffee. It was almost impossible to find anything other than fast food, but not just Western fast food, Indian fast food. They were all there. To get a coffee without sugar was a major challenge, but I prevailed.
Why is it hard to calculate the number of people living with diabetes?
So it's getting good data from the countries across the world. There are good data from some countries, but not from others. But what I can tell you is that the rates are increasing rapidly, and particular areas of concern will be the Middle East, where some countries are as high as 1 in 4 with diabetes. As I said, Indian subcontinent and other parts of South America, the Caribbean. In fact, it's a global problem.
There are health inequalities across the world. So for those without access to affordable healthcare, what could be the outcomes?
I think that affordable healthcare across the world is what we have to aim for, remembering that screening for diabetes is not expensive. The treatments for diabetes are not necessarily expensive, but it's equal access across the world. And that's something that the IDF has really been pressing for through its member associations and through contacts with governments across the world. It's equity of access to screening and to management of diabetes in the hope of preventing the long-term complications which really drive the cost. And in some developing countries, up to 40% of the healthcare budget goes on diabetes. So there's a lot of work to do, but much can be achieved for little expenditure.
If diabetes goes unchecked, what can be the worst cases?
If it goes untreated, then it's the late complications that affect, in my area of research, is late complications, especially the lower limb, loss of the gift of pain, arterial problems in the lower limb, kidney failure, blindness due to diabetes, eye disease, and heart disease and stroke. These are the major complications, but much can be done by screening early on, because early on the complications are silent.
We know the diabetes nurse provides a crucial role, but is access to training key to solving the global shortage?
I think that what we need to do is to raise the profile of the nurse. The nurse is a key member of our team. Now, 25, 30 years ago, I was in charge of Eastern European postgraduate education in diabetes. And I would go to countries where the nurses were there, but they were not used appropriately. They were making beds and bringing tea for the doctors. To cure that, I took a very forceful nurse with me, and she soon had the professors making the tea. So we need to use the nurse to their best effect. The nurse is key. And what we're doing now in IDF to help this is that we're offering, as part of our School of Diabetes, free access to diabetes nurses across the world to programs which will help them get a better understanding of how to screen for diabetes, how to look after patients, and how, hopefully, to prevent the late complications.
The IDF has been supporting global diabetes communities for 70 years. What's your vision for the next 70?
In the next 70 years, what we really need is access to diabetes care across the world. Not only the medical care, but the medications. And this is one thing we've been looking at during this COVID problem, is access to chains of how to get the drug from A to B. Some countries have asked for help, and we've done what we can to help. So it's equity of access to medications and care for people with diabetes, hopefully in the prevention of late complications, which means they can lead a relatively normal, long, productive life.
Thank you, Professor Boulton.